Again, running around 5, 6, 7,000 RPM. Medium pressure on the disc as I'm using that to reduce that excess at the incisal edge. Hello, I'm Dr. Dennis Hartlieb with Dental Online Training, and welcome back for another in our video series, Clinical Tips and Product Reviews for the Restorative Dentist. Today we're going to be doing another review on polishing disc. Composite polishing discs, I think, are one of the most important armamentarium for dentists, for restorative dentists. We do so much work with composites, and I believe polishing discs are key to getting the best contours and best polish with our composite restorations. Today we're going to be looking at the disc system from Clinicians Choice called Contours. If you see in the kit here, the little trial kit that they sent, there are 4 different grits of polishing discs in 2 different sizes. They have the small size, which is 3/8 inch, and then they have the large disc, which is 1/2 inch. They have this mandrel that's cylindrical, and the disc will pop right onto that mandrel. Now, they've set it up so it's color organized, so it's darker color going to lighter color. I really like that organization system. It makes sense. It's intuitive. It's easy to understand. So we have our purple, dark purple, which is the most coarse. Then we have sort of the lavender, which is the lighter purple color. Then we go to sort of a medium pink, almost a rose color, if you will, and then to a very light pink, which is the superfine. So it goes coarse, medium coarse, fine, and superfine. The coarse and the super coarse will be our contouring discs. We should not expect to get a polish with these discs. These discs are only meant to be able to get our initial contour, get a nice smooth surface, and then we'll see what kind of polish we can achieve using the fine and superfine polishing discs. These discs are only single-sided, meaning that there's one side that has this mylar backing. You'll see the shininess. And if you flip it over, you'll see the coarseness where the grit is on the disc. All 4 discs are the same way. One side is a mylar backing. The other side is the grit or the sandpaper portion of the disc. It gets a little harder to tell when you get into the fine and the superfine. Let's take a look at those. This is the superfine disc. This is the light pink. And as I rub my instrument over top of it, it's a little harder to tell. You can see a little bit of the shine from the mylar there versus the polishing surface here. Another way you can tell which is the polishing side versus the mylar backing, if you look at the ring, you'll see that the size of the ring is larger on the non-polishing part of the disc. If you flip it over, the smaller portion of the ring is on the polishing side, which makes sense because we want to avoid hitting that ring on the composite or on the tooth as we're polishing. As you may know, that may cause like a scratch or a mark on the composites. For this polishing exercise, I've created a composite veneer for the right central incisor. So this is tooth number 8 for us in the US, or 1-1 for our international dentists. I've purposely left the composite veneer a little long and a little bit bulky. So the nice thing with this type of mandrel and the disc, it pops right on. Easy pop on. And again, we're going to run this disc about 5,000 RPM. The key is get as much of that disc on the composite surface. You're going to see how I'm flexing that disc. But you have to be careful because this disc will remove composite pretty easily. So I'm going to be very easy as I'm removing my excess material, but notice the flex on the disc. And notice how I'm not taking my disc and I'm not swiping it on and swiping it off, swiping it on, swiping it off. If you do that when you're working with your composite, you're likely going to see some scratch marks on the composite because every time you lift the disc off the surface, you're going to scratch the composite. Every time you land the disc back on the composite, you're going to scratch it again. So I want to keep the disc onto the surface. I'm going to work the disc around the tooth, rotate it around. And then as I look at the surface, There was not a lot of gross excess to take off, but I took off that initial excess. Maybe a little bit more on the distal here. With disc, as the disc starts to become full with the composite dust, it's going to be time to change off the disc because it becomes much less efficient as it's getting clogged up with the dust. Okay, I'm going to clean up my restoration. Now, when I'm polishing with discs, I always polish without water. The reason I want to polish without water is I'm looking for the composite dust as I'm contouring to settle into any defects, any pits or any defects, because I want to be able to remove those defects at this point before I go to the polishing phase. If I use water spray while I'm using discs, it's going to rinse that composite dust out of those defects and becomes much more difficult for me to identify. If you do notice a pit or a defect while you're doing your contouring and you're not able to eliminate that defect without ruining the contour of your composite, you need to do a composite repair. If you want to know how to do a composite repair, check out one of our other videos on our clinical tips and product reviews with dental online training, or go to dothandson.com. Okay, let's continue on. All right, I've removed the gross excess with that coarse disc, but now I need to adjust the length. So I'm going to grab a new large purple disc. I'm having the disc cutting surface away from my handpiece, just like I did previously. I'm going to tip my disc at a 45-degree angle as I'm adjusting the incisal edge, and it'll look something like this. Again, running around 5,000, 6,000, 7,000 RPM. Medium pressure on the disc as I'm using that to reduce that excess at the incisal edge. Now I have to be careful as I'm finishing towards the incisal edge. I got to be careful not to bump the adjacent teeth. So that may be a time for me to switch over to the smaller disc, a 3/8 size disc. I need to come in and adjust a little bit more and to start opening the incisal embrasures. I'm running these discs really quite slow, around 3,000 to 5,000 RPM here as I'm starting to detail and refine. Now, understand this is the coarse disc. We're going to be using a medium coarse disc, which is also going to be very helpful in removing excess composite. So with the coarse disc, I'm not looking to get the final contouring shape. I'm going to be using my medium coarse disc to help with that. So with the coarse disc, I want to remove essentially the gross excess, and then I'm going to go to the medium coarse disc to help dial in where I still have some excess contour, where I need to actually finish into the embrasures. If I have a lot of excess around the proximals into the embrasures, I would use the coarse disc. But if it's just a little bit like I have in this case, then I'm going to go to the medium coarse disc. I'm going to start first working on the facial embrasures and the incisal embrasure. To do those, I'm going to be using the small disc or the 3/8 inch disc. In this case, I have the disc on with a polishing surface facing away from my handpiece. So I'll work at something like this. Again, I'm going to run this around anywhere from about 5,000 to 10,000 RPM, depending on how much composite I need to remove. So moderate pressure. You want to be flexing that disc because that's how we're going to achieve a nice smooth finish. And I'm bringing these discs to the contact point, but not through the contact point. So I'm using it to open up the facial embrasure and to reshape that incisal embrasure to give it more curve, like what I see on the distal of the tooth we're trying to match. It's critical to identify where the line angles are when you're doing these composite veneers, or if you're doing a class 4 composite. For more information on that, then check out Dental Online Training. We have a whole host of courses on line angles and contours for central incisor, for lateral incisor, and canines. All right, so working over that distal facial embrasure to open that up, now I'm going to go over to the mesial embrasure. To do that, I'm going to start with a new disc, and instead of the disc facing away from my handpiece, I want the polishing aspect to be facing towards my handpiece. So I'm going to be running the disc now from the embrasure into the tooth. And again, I'm running this disc around 4,000 to 5,000 RPM here, and then I'm going to speed it up as I need to get more composite removed. Change my disc and do that again. And again, you see the large size of the mandrel is facing away. That means the cutting surface is towards me. You're going to have to open up the mesial embrasure, the incisal embrasure, and you can even use these small discs to work around the gingival margin. In the mouth, let me dry this off. In the mouth, I would use some sort of retracting instrument. I'm not able to do it here because I need to hold the model, but I would retract the tissue and be able to use this small disc to come right around the gingival margin. Obviously, we could use rubber cups and some other instruments for that, but these work well. Coming right into that gingival contour, using these extra small, these 3/8 inch polishing discs. You can see the little black mark that was made right here. That's from where the brass center or the metal center bumped into the composite. We're going to eliminate that in just a minute when we go to the larger disc. Now, as I go over the facial surface of the tooth, I'm going to use the large disc. I always want to use as large of a disc as I can over the composite surface. That's how we get the smoothest surface on our composite. And you can notice how much I'm flexing that disc, getting as much of that disc onto the composite surface, running this disc somewhere between 6 to 7, up to 10,000 RPM, but these are fairly aggressive and they will take off some of your composite. So moderate pressure, keeping the disc onto the composite surface. It's absolutely critical at this stage when you're in this contouring phase. You've used the coarse disc and the medium coarse disc to really evaluate for any pits or any defects in the surface. At this point, before you start going to the polishing sequence, it's time to do your pit repair if you see one. Because when you polish, it's just going to highlight that pit or that defect. But once I have a nice smooth surface like this, I do see there might be a little defect right here at the edge. There's this little white area. I'm going to continue to work that with my disc, and that is quickly eliminated. I'm going to refine the incisal edge. I'm going to be looking from the proximal view to make sure that I'm not overextended facially. Looking from the cervical view to look at contour, and I can see I'm maybe a little bit bulky on this gingival third. So I'll pull out another of my medium coarse 3/8 inch disc, small one. I'm going to come in with a cutting surface towards the handpiece. And notice the flex that's on the disc as I'm rolling in that contour. To narrow that neck at the gingival third to give it a more appropriate contour. Now understand, still need to use finishing strips in between the teeth. These discs should not go in between the teeth. If you're running your disc in between the teeth, you're going to open up the proximal contact. So you need polishing strips for that. When you look at the neighboring tooth and you see the shine that you see on the plastic, and our tooth is just sort of matte finished and dull. That's exactly what we're looking for at this stage. So we're done with the medium course. We should have this matte finish, free of defects. We have the surface that we want. Now we're going to go in and do our polishing. To do our polishing, we have our two size discs. We have our fine and our superfine. We're going to start out with the large, a 1/2 inch disc. When I go into my polishing sequence, I'm going to be increasing my speed. I'm going to be increasing the pressure on the disc. So I'm going to run this around anywhere from 12 to 15,000 RPM. And immediately you can start to see some of the shine starting to come out. Now we haven't gone to the superfine and we haven't used any polishing paste, but still for this first step, that looks good. I'm going to go in with the smaller disc now. The cutting surface is towards the handpiece. Large size of the metal is facing away. And I can come in. Again, getting flex on the disc. I'll do the same thing on the distal, taking a new disc. And notice the flex that we get on the disc. And I'm going to pick up my speed. I'm going to run this again, somewhere typically between 12 to 15,000 RPM. And it'll look something like that. And one more time with my fine polishing disc to large over the entire surface, just blending everything together here. But you can see that these fine discs actually do take away some composite. You can see the composite dust. So I am getting a decent polish with that, but this has still got a fair amount of grit on it for a fine disc. So again, run that around anywhere between 10 to 15,000 RPM, but it is going to be taking off a little composite, so just be aware. All right, as we clean up our tooth there, we can see now it's starting to pick up a little bit more shine. Still sort of like in between this matte and matte finish and shine. Let's see how we do when we go now to the superfine polisher and see how much of luminance we can pick up with that. I'm going to start out with the small disc, working into my embrasures. We're running this again, somewhere around 12 to 15,000 RPM for the larger disc, where I don't have to worry about getting into the tissue area or into the proximal. I'll run it a little bit higher. Lots of firm pressure on here. All right, let's take a peek. Overall, it's got a decent polish. It's not super shiny. Again, this is a nanofill, so my expectations on the high gloss is going to be limited. So it's got a pretty decent polish. Again, understand clinically, I'd be running through with proximal strips to polish interproximally. So this is just talking about the facial polish I can get using the disc and into the embrasures. Got a nice gloss, nice shine, maybe not quite as shiny as what I'm getting on my plastic teeth, but still a pretty decent shine with these discs. Overall, I think these discs are nice to work with. They're easy to work with. They pop onto the mandrel nice and easily. They have 4 different grits, which is great, from the coarse to the superfine, and 2 different sizes. I think it'd be nice to have one size that's a little bit larger, but overall, I think that it's a nice disc system. I think it did a nice job of getting a nice smooth contour onto the composite restoration. Well, that's it. I hope you enjoyed the review of Clinicians Choice contour discs. This is how I would use them over a tooth in practice. Again, understanding this is just meant for facial contouring, and we did not go into adding secondary anatomy, adding surface texture. If you want information on that, then again, check us out at dothandson.com to get more information on that. I hope you enjoyed this video and look forward to seeing you on other videos for our clinical tips and product reviews for the restorative dentist. Yours for better dentistry, I'm Dr. Dennis Hartlieb.